Hello, Hello, everyone. Thanks for coming to our presentation on the self-care after C-section. My name is Katie Ouillette-Harrington. I am a doctor of physical therapy. I specialize in pelvic health. I'm also a sexuality counselor and educator. If you guys have any questions throughout the presentation, there is a Q&A button that you can hit within Zoom, and you can ask questions to where it won't pop up in the chat. So you can ask those privately. So our objectives for this presentation, we're going to understand the incidence, procedure, and risks of a C-section. We're going to learn about your anatomy and how the C-section affects your body and everyday functions. Then we're going to learn about early interventions and exercises that you can start post C-section to optimize your recovery, return to previous level of function, and decrease your injury rate. And then a little bit about myself. I started off my college career at Delta. I became a certified personal trainer and health fitness specialist, and then transferred to Central Michigan to get my bachelor's and my doctorate. And I started postgraduate education in pelvic health pretty much, actually I was still in college. So started out in college and have been continuing ever since. And then I went through the University of Michigan School of Social Work to become a sexuality counselor and educator. And about my personal life, I live in Midland with my husband. I have 2 stepkids and 3 dogs and 2 babies on the way. They will be here in the summer. We like to stay pretty active and we like to hike. So looking at female bodied anatomy, on your left side of the screen here, this picture, we're looking at the body coming in from the side. So we have your bladder, uterus, vaginal vault, and then your rectum. This pinkish color down here, those are all your pelvic floor muscles. They're attaching from your pubic bone on the front onto your tailbone on the back. So they're like a sling that's holding up your organs. This picture on the right is from the downside looking up towards your head. So this would be your pubic bone in the front. Your tailbone's back here. This is like the bony part, your sits bones in your butt. And then we have your glute muscles coming in from the back. And then these are all the different layers of your pelvic floor muscles. So we have your urethral opening, vaginal opening, and then rectal opening. And all of that red is your pelvic floor muscles. Looking at the function of your pelvic floor is a lot of different jobs. So we think about the 5 S's. So looking at support, muscles act as a basket to support our pelvic organs, so our bladder, uterus, and our rectum, against gravity and abdominal pressure. So they need to withstand all of that pressure that's coming down. Sphincter control, the muscles wrap around the opening of the bladder and the rectum to prevent leakage. But those muscles have to be able to relax to let everything out. So if you're having difficulty emptying the bladder or the bowels, there is a possibility these muscles are overactive and not relaxing all the way. Stabilization. So these muscles are attaching to both of the hips and your pelvis, is an important part of the core, and maintaining stability and mobility of all of the joints around there. So if you're someone who has chronic SI joint pain, sciatica, low back pain, hip pain, pubic pain, pretty much pain at all, any of the joint areas around your hips, and you're also presenting with some pelvic floor dysfunctions, there's a possibility it could be pelvic floor related. Sexual function, our pelvic floor muscles help to achieve erection of both the clitoris and the penis and allow for penetration of something into the vaginal canal. This dysfunction, any dysfunction here can lead to pain with intercourse, difficulty maintaining an erection or achieving an orgasm. And then for the sump pump, if we think about the top of our diaphragms here and our pelvic floor is here, when you inhale, your diaphragm lowers and flattens. So should your pelvic floor come down. When you exhale, it comes back up. So when you're breathing, that's what creates that pistoning mechanism. And that helps with blood and lymphatics back towards the heart. Looking at what makes up our core, that's a very important part of how our whole body functions. Our pelvic floor we just talked about. So if we think about the whole core as like a pop can, the bottom part is our pelvic floor. The front is our transversus abdominis, which is that muscle we see pictured here. That's the deepest muscle of your core. So it is our main stabilizer, and it works directly to support your pelvic floor and co-contracts with your pelvic floor. At least it should. These muscles contract together before movement to lengthen and stabilize the spine, pelvis, and pelvic organs. It helps maintain intra-abdominal pressure. So if we're going back to the pop can analogy for this next slide, the top of the pop can is like your diaphragm. So we know when you breathe in, your diaphragm lowers and flattens. When you exhale, it comes back up. The back of your pop can is what's called your multifidus or your multifidi. That is this picture on the right. So these muscles that line along the entire spine, they help stabilize the whole spine, especially our low back. These muscles also have to contract together before movement to lengthen and stabilize the spine, pelvis, and pelvic organs. And if we, again, go back to that pop can analogy, if we think of all of the sides of the pop can working correctly, synergistically, it's like our pop can is closed. The integrity of it is good, it is stable. You can't really move it around very much. If we were to have dysfunction happen to any of these muscles, it's like we're opening the pop can, so we're losing some of that stability, strength, and integrity of it. We can move it around and we can squish it a lot more, meaning that can lead to some dysfunction. So looking at your core at work. So like we talked about, your breathing creates a pistoning system that helps with pressure control. So that canister balance, that pop can, is important for controlling the increase in intra-abdominal pressure and decreasing pressure on the pelvic floor. So this image to the right is a really good depiction of how the pelvic floor and the organs move with breathing. All right, looking at the incidence of C-sections. So in the United States, in 2021, 32% of live births were cesarean deliveries. In 2021, the rate of primary cesarean deliveries was 22 per 100 live births, compared to women who have not had a previous delivery, C-section delivery. So being that was their first one. In 2021, the rate of a VBAC, so having a vaginal birth after a C-section, was 14 per 100 live births to women who have had a previous C-section. So what we're seeing here is that VBACs are not as common if you have already had a C-section. And we've seen a general increase in C-sections from the past into the present. And as a little side note, just because you've had a C-section does not mean for your next birth that you're going to have one. Looking at the procedure of a C-section. So if we look at these pictures off to the right, you can see the different cuts that can be made. So you can either have a vertical or a horizontal incision. So if we're looking at the picture down at the bottom, you can see my mouse. This first one is a vertical incision down from the belly button to the pubic hairline. The one to the right of that is a horizontal or bikini, and that's along the pubic line. This heals well and there's less bleeding, so we see significantly more C-sections done this way. And we are cutting through the abdomen and the fascia with this. And the fascia is a connective tissue that sits on top of the muscle. And once they get that open, we're looking into the uterus. So there's an incision into the uterus made after that. So we can have a transverse incision along the bottom. We can have a vertical incision, or we can have a classical incision where they go right through the middle of the front. Then your fetus or fetuses are taken out. The babies are taken out. The placenta is then taken out, and then you're sewn up layer by layer. So everything that they cut through, they have to sew back together piece by piece, making sure that everything stays where we need it to stay. So looking directly at our abdominal muscles, this, if we're cutting through the horizontal or the bikini line one, this is where they're cutting through down here, and then vertical would obviously be right here. So we're cutting through 4 different muscles, cutting through the abdomen. So we have your rectus abdominis, which is like your 6-pack muscle. We have your obliques, which are the ones that are oriented obliquely. And then your transversus abdominis, our deepest core muscle in the back. So this is another picture where we can see how the C-section is completed. So we have cutting through your skin, the fat layer, muscle layer, peeling that back, cutting through the uterus, and then taking the baby out. Reasons for a C-section. So I would like to just add in here that a lot of times our birth plans do not go as planned, and you may have really wanted a vaginal delivery and you ended up having to have a C-section. And it's important to give yourself grace when it comes to that. Some things are out of your control, and C-sections are okay too, as long as you and the baby are healthy. That's what's most important. So reasons for a C-section, we could have abnormal fetal heart rate. So if their heart rate's dropping too low or it's getting too high. Baby's position. So our normal position is for the baby is head down, facing the mother's back. If the baby is breech, so head up or transverse, lying this way along the belly, it's going to be hard to do it's going to be hard to do a vaginal delivery, or it could be unsafe to do a vaginal delivery. If we have problems with labor, the labor's not progressing. So if you're not dilating, if the baby's not coming down, size of the fetus. So sometimes the mother's body might not be well accommodated to maintain a larger size baby. So if you are smaller in stature, even if you're not smaller in stature and you have, let's say, close to a 10-pound baby, a lot of times they will opt for a C-section, not always, but a lot of times. Having multiple births, so having twins or more, and vaginal infection, because if you do have a vaginal infection, that could be transferred to the baby if you do a vaginal delivery. Placenta previa, which is where your placenta is blocking the cervix and that vaginal opening, so there's no way the baby can come out that way. If you've had a previous C-section, so a lot of times you can have a VBAC after a C-section. It's just something you need to talk to your OB about. But sometimes they do opt to have a C-section again, and just kind of depends on the doctor and what your circumstances were in the previous delivery and what they are now, or a cord prolapse. So that is where the cord tends to like fall out of the vaginal opening. It can kind of kink it off, and that will decrease blood flow to the baby, and that can cause them to be in distress and cause an emergency situation. So in that case, they're going to go in for a C-section so they can make sure that everyone's staying safe. Risks of a C-section. So to the baby, there can be breathing issues or surgical injury. Surgical injuries are not very common, but they do happen where they accidentally get nicked. To the mother, there can be an infection just due to the nature of having surgery. You could have excessive blood loss. There could be blood clots. There could be a reaction to anesthesia, and then also a surgical injury. So you could end up having some effect to your nerves and how things function. So sometimes I've seen people who have had a nerve injury after a C-section or after some abdominal surgeries anyway, just because there's so many nerves that go through there. So preparing for post-delivery in the hospital. So C-sections usually require 2 to 3 hospital stays as long as everyone's doing okay. Once the anesthesia wears off, it's really important to walk and get your body moving. This helps with constipation, it helps with blood flow, it helps preventing blood clots. But we also want to listen to your body. You want to start small. C-section and is major surgery. After any delivery, we have the injury the size of a dinner plate in the side of our abdomen, because that's how big a placenta is. You need to make sure you're listening to your body, but also starting to be mobile. A lactation consultant if you plan on chest feeding, and especially if it's your first birth, they'll be able to help you with latching and any issues or questions you may have. So preparing for delivery at home. Rest when possible. So like I said, C-sections is a major surgery. So making sure you're taking time to rest. There will be lifting restrictions. Usually it's about 25 pounds, but it can be different depending on your body and how your doctor wants it to be. Waiting at least 6 weeks to have penetrative intercourse. So after a C-section, you are going to have some bleeding that's coming out of the uterus as it's coming back down and getting to its regular size. And you might like I said, it's a major surgery. Even though you didn't have a vaginal delivery, It still is probably going to be uncomfortable with the abdomen, and you want to make sure that you are well healed. So waiting to drive is another one, especially if you're on pain medication. They're going to they're going to want you to wait to drive until you're off of that pain medication. And you might have some discomfort with twisting to like look in your blind spots as well. Constipation is a huge one. Taking narcotics will automatically make you constipated. You want to make sure you're drinking enough fluids, especially if you are pumping or chest feeding. You drink more water than you think that you need. Ask about stool softeners. So that's making sure that your stool is staying soft, to make it easier to pass, increasing the time or decreasing the time it takes for the fecal matter to pass through. And also, if you're constipated, it's probably not going to feel very good to push. So try not to have to push a lot to get your poop out. Another thing that I did not put on here is having a squatty potty or a stool for under your feet. That improves the angle of how the stool comes out of your rectum. So if your hips are below your knees, if hips below knees, poop with ease. Because if your knees are below your hips, there's a muscle that tightens and it comes around and it tightens on the rectum. So then you're having to poop around that. You have to push around that ankle to get the poop out. But if your hips are below your knees, it straightens that out and you're not having to push through there. Fiber intake is important. Also making sure to keep the stool soft. Splinting. So if you feel like you're having pain, if you cough, sneeze, laugh, what you can do is take a pillow on the outside of your abdomen, pushing it there and kind of adding some pressure when you cough, sneeze, laugh, and that will take away some of that pain. And then you're going to want to avoid baths or soaking the incision until it's fully healed and the postpartum bleeding has stopped. Symptoms of infection to be aware of. If your incision is red, swollen, or is leaking discharge, if you have a fever, if there's a lot of bleeding or worsening pain, definitely talk to your doctor about that. Sleep hygiene. So sleeping is very important for healing, especially after giving birth, and especially if you are producing milk for your baby. So one thing is log rolling to get in and out of bed. The next slide will show how to do that. Avoid sleeping on your stomach. You're not going to want a lot of pressure there. It's not going to feel very good. Sleeping on your back or your side is what's recommended. So if you are on your back, I'd recommend putting a wedge under there so you are transferring a little bit easier and you're not having to like do a full sit up, which is where the log roll comes in anyways. But it should be a little bit more comfortable. That way it's not putting a lot of stretch on that scar yet. You can put a roll or a pillow underneath your knees if you're sleeping on your back. That will help that discomfort in the incision. And then if you're on your side, putting a pillow in between your knees and then behind your back so you're not rolling around a bunch. And if you are chest feeding, having your partner or your helper bring the baby to you at night so that you don't have to get up a bunch of times. And if you are using formula, asking them to do the nightly feedings and the diaper changes that night will help you get that rest in and not have to get in and out of bed a bunch. This is a log roll. If you're laying on your back, you're going to turn to your side. You're going to put your feet off the front of the bed and then push yourself up from the side. You'll come up to sitting and then you can get up. So if you're going all the way from your back, sitting up and getting out, you're going to be using all those abdominal muscles that just got cut into. It's going to be very uncomfortable. And using those before you're ready can actually increase your chance of having pelvic floor issues or getting a diastasis where those abdominal muscles separate. Optimizing body mechanics is important to, again, prevent injury. So we want to avoid repetitive bending and lifting. So set up baby stations ahead of time, and you want it at about hip height. That way you're not bending over a lot and sitting back up. It's more accessible to you. If you are chest feeding and actually even bottle feeding, having your nursing station be set up too is important. So having your feet supported, a pillow underneath behind your low back so your posture is as good as it can be, and then a pillow to support the baby and keep off the incision so there's not a lot of pressure there. Lifting mechanics, especially to protect your back. We'll go through an acronym of back. So B, the back is kept straight. So when you bend over, you don't want to hunch. A, we want to avoid twisting to lift or carry the baby. So if you're going to get the baby out of the car, you don't want to be lifting and twisting at the same time. You kind of want to pivot. Keeping anything close to your body as you're lifting or carrying, and then keeping movements smooth, avoiding sudden or jerky movements will help protect that incision in your body. Okay, so I did have a slide in here on toileting mechanics. So this will help with, again, the constipation and having to strain. So using a stool under your feet when having a bowel movement, that will help with the angle of that colon, so you don't have to push around it. And avoid trying to push or strain, and your pelvic floor and your incision will thank you for that. Looking at scar management, this is one of the most important things that you can do, and sometimes it is not talked about enough. So we want to prevent adhesions and promote proper tissue orientation as it's healing. So when our scar tissue forms, the fibers will lay down very haphazardly and in all different directions. So their fibers aren't going to lay down the way that our skin was before. So this may adhere to the surrounding organs, and then any tissues it comes into contact with will adhere to it as well. It's very common to have adhesions with a C-section. Can be onto your colon, your ovaries, in between your bladder and your uterus. But that can be prevented and treated with the scar massage that we're going to talk about. And the scar tissue needs to be taught how to lay down properly. And a way to do this is by massaging your scar. So whether it's new, several months, several years, it can help you now and avoid problems down the road. So if we do have adhesions present, that can lead to low back pain, pain with intercourse or pelvic pain, frequent urination, abdominal pain. As soon as the wound is closed and it looks like it's well healed enough, you can begin the scar massage. And another thing is desensitization. So if you notice that your skin around the area is hypersensitive, meaning that it doesn't take a lot to feel, or it can be in the opposite end where it's numb and you can't really feel very much. There's techniques that we can do to help with that, to kind of get it to normalize. So this can also be done months or years later to help improve pain sensitivity and numbness. So one thing you can do is you need a cotton swab or like a cotton ball, a makeup brush, and a towel. So for each one, you're going to start. So we'll start with the cotton swab because that is the most gentle. You're going to swab above the scar and below the scar, and then across the scar. And then you'll take a makeup brush, sweep above the scar, below the scar, across the scar, and then same thing with a towel, above the scar, below the scar, across the scar. And that can be done 3 to 5 minutes daily. So we're going to look at a scar massage demo of what you can do. Like I said, as soon as the incision is closed and it looks well healed, we don't want to reopen anything. This can be also done years later after a C-section. Let me go ahead. Right, so working with the first layer of skin, you're going to go above the scar. You're going to pull up, pull down, and we'll go side to side. We're going to find an area of where there is restriction. You're going to hold it there until it releases. And then you can do little circles around the scar above and below. You're going to go significantly, a few inches above, a few inches below, and then from hip to hip. So now what she's doing is she's going below the scar and she's moving her fingers kind of like a piano, again, finding some restrictions, working the scar as a whole, or moving side to side, up and down. Now what she's doing is she's picking up this skin and she's rolling it. Getting into the second layer, also always going to want to start with that first layer and clearing those. You're going to go directly onto the scar, sink in a little bit until you can feel the muscle tissue. There's going to be a difference between that first layer of skin and the muscle. So again, we're going to go sink down, go side to side, up and down, move until you find an area that it doesn't want to move in and hold it until it releases. Then we're going to the third layer, going to bend your knees up so that you can sink in deeper into the tissues and get to your organs. So you're going to get through, you're going to push even deeper than the muscle layer. And again, move up and down, side to side. Same thing, find an area that it doesn't like to go in and hold that. You can also cup your fingers to get underneath your pubic bone kind of, and that's where you can get a little closer to your bladder. And then that way you can kind of get under the organ and move it up and down and side to side. So that's all 3 layers. Equipment recommendations. So immediately post-birth, you can get a girdle or a belly wrap that will help decrease pain, bleeding, and discomfort, and also improve mobility and transfers because it's helping with that intra-abdominal pressure. So you can wear that, start off 4 to 6 hours a day, increase to 8 to 12 hours a day at times when you're most active. So you don't have to wear it when you're sleeping, but when you're up moving around during the day, that's when it's most helpful. I recommend usually wearing it up to 6 to 12 weeks postpartum. Always check with your OB or midwife to make sure these are okay for you. They need to examine your incision as well to make sure it's okay to have that external pressure. The binder should not cause any discomfort. And then when tightening the Velcro, one thing you want to make sure, a few things you want to make sure of, the binder is not too tight. So if you cannot put at least one finger inside the binder, it might be too tight. You want to make sure you can still take full breaths. You want to feel supported, and it should be easy to put on. So what these abdominal wraps are attempting to do is bring those muscles back together. So if you had a muscle separation, which most of us do at the end of pregnancy, you can't really stop it because your belly's growing, helps bring those muscles back together, decrease your uterus size. Oh, the silicone cover, that is, I forgot what that was for a second. The silicone cover is meaning a cover for your scar that helps with scar tissue and bringing in regeneration to the area. And then ice is another recommendation. So at this next slide, we can see a few different types of bands for your belly. So this top one is a belly bandit. This one does not give you any bottom support. It's just wraps around the front. This bell fit does give you bottom support. So that's like a girdle, like you're putting your legs through that one. And then the mama strut will give you some abdominal support and some pelvic floor support. So that's where this part is coming in. So you have pelvic and perineal support. It gives you some support in the pubic symphysis, lower back, abdominals, and hips. The ab system to the right here, it comes with a wrap and a tank top. That is one that's really geared toward bringing those core muscles back together. And then this is a silicone patch that you can get that will cover the scars, that helps with regeneration. And this is like a fanny pack that's an ice pack. So you can just wear it around and not have to lay down and hold it on there. So looking at safe return to exercise, you want a 6-week minimum waiting time after your postpartum visit to begin exercise. Walking and gentle exercise is okay prior, and you want to use a few different things as a guide when you're doing those. So pain is one. If you have any pain that's above, I would say a 3 out of 4, that's a hard stop. Stop doing what you're doing. Abdominal doming or coning. So if you ever go to sit up and you notice that your abdomen or whatever you're doing, you notice your abdomen is like coming into a cone or doming, that means you are not maintaining enough core stabilization to do whatever you're doing properly. So that means you need to step back on whatever you're doing. If you keep doing that while you're having the doming, that can lead to pelvic organ prolapse and a diastasis. Then if you're having any leakage, because that's again telling us that we're not maintaining good intra-abdominal pressure and we have too much coming down into our pelvic floor. And I would say it's in your best interest to at least get an evaluation with a pelvic floor PT, so we can look at any deficits that you may have and things that you can start with so that you can get back to being mobile and being safe in what you're doing. So how can therapy help? So we look at your deficits that may be contributing to your current complaints. So we're looking at abdominal core, if you have any hip weakness, trigger points or painful areas, how is your muscle length, how is your stability, pain, and then if we need to do any bladder retraining. So we're assessing this entire system. So of not just your pelvic floor, not just your abdomen. We're also looking at hips, low back. Things that we can help with specifically that we're most often looking at for our postpartum individuals: core strengthening, especially if you have a diastasis, scar massage like we talked about. We'll teach you how to do that at home. Breathing mechanics, lifting mechanics, posture, that's all going to change how weight and pressure is coming down into your pelvic floor. We can manage constipation, leakage, if you're having urinary frequency and urgency, there's treatment we can do for that, and then pain with intercourse. So some exercises, demos are coming next here. So I'll have you put one hand on your chest, one hand on your belly, sit up nice and tall. Your feet should be on the floor. Relax your belly, your butt, and your pelvic floor muscles. I want you to take a deep breath into the hand that's on your belly. We want to think belly first, belly big, chest little, chest last. You want to breathe in and out through your nose. This helps with getting some movement down into that lower abdomen where the C-section cut through, but it also helps us get lengthening of the pelvic floor, which we need, and getting some motion back in the abdomen as well. Sometimes what we'll do is if we are in pain in a certain area, we tend to clench and hold it. If you're clenching and holding your abdomen, you're not getting a good diaphragm breathe and good abdominal excursion. And I believe we do have a handout of all these exercises too coming afterwards, so you won't have to remember all. Belly bracing. So our transversus abdominis, like we said, is our deepest core muscle. When any muscle at all is cut into, it kind of gets amnesia and it forgets how to work. So that is where recruiting this comes back in. So you'll lay on your back is the easiest way to do this, but if you're having trouble getting up and down, sitting is okay too. So you're going to soften your upper belly, draw on your lower belly just above your pubic bone. You can imagine there are wires or a string connecting from one hip bone to the other. You want to tighten this string. That's one cue. Another cue, if that doesn't work for you, if you say, shh, that muscle will tighten. You can think about narrowing your waist or putting on a tight pair of jeans. So if you put your hands on the inner sides of your hip bones and you're feeling what the muscle is doing, you should feel this muscle move down and away from your fingers. You shouldn't feel a muscle bulge out into your hands, and you also shouldn't feel your belly come out into your hands. So this should just be a gentle tightening and moving away from your fingers. So this is the diaphragmatic breathing we went through. We want to go through this about 20 times, 3 sets daily. Like I said, this one can be also done lying down. If you are lying down, have your knees bent. And then this is the belly bracing, adding in a ball squeeze. So when we are activating those inner thigh muscles, that will automatically help the core get activated a little bit better. So you can brace the belly and squeeze either a ball, a pillow, or a rolled towel in between your legs at the same time. You should feel that muscle again, tighten and moving away from your fingertips. You should not feel it bulging. You want to hold for 5 to 10 seconds. Repeat that 20 times daily, at least once a day. So with open books, a couple of these ones coming up are for posture. So as we're going through pregnancy, our posture obviously changes because our belly is growing. And then afterwards, if you even chest feeding or bottle feeding a baby, you tend to kind of get into positions that whatever works for the baby, and sometimes at our own expense. So we start to kind of get that hunched over posture, and this is working on opening that up. So with open book, you're going to lay on your side. Your top leg is going to be bent towards your chest, so your knee and your hip are about 90 degrees. You can rest your knee on a ball or a pillow. Your arms are going to be straight out in front of you, and you're going to open that arm up so your chest is nice and open, and you can also follow your hand with your eyes so you're getting that good rotation at the top. We want to do 20 of those on each side. I think we have the same pictures on these. All right, so
that's my fault. I'm sorry, Katie.
That's okay. I'll talk through it. So with the this is the picture from the open books, but I'll talk you through what the angels look like. So you're going to lie on your back, your knees are bent, your arms are in a 90-90 position like this. So you're going to breathe out all of your air through your mouth as if you're blowing through a straw. At the very end of your exhale, you're going to feel your abdominals contract, and it should kind of force your lower back to push into the floor or whatever you're laying on. After a full exhale, allow yourself to inhale again. This time, don't bring your low back off of the floor. Let it stay there. Continue to breathe while we're holding this position so you get used to it. And then we're going to work on moving our arms up like you're signaling a touchdown and bringing them down. You could do this in sitting. You're still getting that nice opening, but it's more functional to do it lying down because you can get that position better. 20 times daily for that one. Becoming, this is a really gentle, very small squat just to get your muscles activating again. So you're going to stand approximately a foot away from a stable surface like a kitchen countertop or a chair that doesn't roll. Your feet are about hip width apart. You can move your toes out just a hair. In the surface should be at about belly button height. So you want to keep your weight onto your heels. You want to keep it backwards a little bit. You're going to place your hands on top of the countertop. You're going to squat down to about a quarter or a half squat, making sure your knees aren't going over your toes. And then once you come into standing, this part is important for people after getting C-section. You're going to come into standing. You're going to extend your head backwards and kind of bring your chest out. That's going to get a good stretch of that lower abdomen where the C-section incision is. Start with 5 to 10. So just do a few. Again, make sure you're listening to your body and work your way up to 20 times a day. Another one that will help with posture is a chest and a bicep stretch. So bringing your hands behind your back and clasping your hands. You're going to bring your chest forwards and kind of push it out. You should feel a stretch in your chest, arms, and probably a little bit in your abdomen. If you want to feel more of a stretch, lift your head up towards the ceiling, and we'll hold that for 60 seconds. All right, and then this one's also a good posture one. So you can be sitting or standing, your back is straight, your shoulder blades should be down and back, arms are at your side, bring your elbows up to about 90 degrees. So it's like you're kind of performing like a Y. Like Y. In a W shape. So your arms are going to be a W shape. You're going to rotate your arms backwards. And you should feel a good stretch in the front of your chest. And also your upper back should be activated. Hold for 5 seconds. And then return to the starting position. So again, I think that these should be in a handout coming after. So results observed clinically. So most patients see a significant improvement in strength after 6 to 8 weeks. Consistency is key with this. So if you're only coming to the clinic every so often and not doing your exercises, you're probably not going to see very much improvement. If we're working on bladder retraining, you can see an improvement in a control of urinary incontinence or urgency within 3 to 6 weeks. And then we usually see people 1 time a week or every 2 to 3 weeks, and that just depends on the patient. So when it comes to your home exercise program, think about how you brush your teeth frequently, but you don't go to the dentist as frequently. So just like you brush your teeth in between going to the dentist, you need to do your exercises in between seeing your therapist. So with Renew, we have a few different locations for pelvic floor therapy. I am in Midland, and at the Bay City West location, we have 2 therapists at the Saginaw Pelvic Health location, and then we have a Caro location. Any questions?
We did have a couple great questions, so thank you to those who submitted them. One person asked if before their 6 weeks postpartum, if you think it's okay for them to sit on the floor and do bridges or deep breathing exercises, if you'd have any
Yes.
concerns there.
Yep, that would be just fine. I would again use those precautionary things we went through as an indicator of whether or not to continue. So making sure that you're not having pain, making sure that you are not seeing any doming or peaking in your abdomen. Are the biggest things. And then making sure you're not holding your breath when you're exercising.
Great. And I did want to confirm too, all the exercises are in a printable guide that will go out in an email, and the pictures are all correct in that guide. So sorry about that. And then there's also a link to this webinar and to the scar massage video in that email as well. So that'll all come. Another question about the scar massage. She asked if you're going to do the way it's broken up into the 3 different layers. She asked if you do all those in the same massage session, or if you want to break those up throughout the day.
So if it's not painful, then I would go ahead and go through the whole thing. If you find that once you get through that one layer and the next layer, like this does not feel good, this hurts, I would wait and try again the next day. If it's uncomfortable, that's fine. But if we're getting into a painful response, we don't want to do that. So as long as it feels okay, it's fine to go through the whole thing.
Okay, and then just one more question. Somebody asked that sometimes with the C-section, they get that little skin flap that covers the scar, and just wondered if you had any tips, if it'll just go away, or if there's any exercise tips to kind of work on that flap.
Yes. So the scar tissue massage will help with that, because why that happens is you have those adhesions at that scar. So your skin's coming down, but then once you get to that area, it's like really tight against the abdominal wall. So working through the scar tissue massage will help with that. And then working on core stabilization will also help with that.
And you said the massage will help even years later, or
Yes.
a certain amount of time later. That's still helpful.
Yep. Years later, it's going to take a little bit longer than if you were to start sooner after you have the surgery, but it definitely can be helped. I will also do some different types of manual on scars when I have my patients come in here, and I've had patients that have been years after they've had C-sections, and we can get that tissue moving again.
Wonderful. That's all we had for questions.
All right.
So thank you so much for sharing this with us. I learned a lot. That's for sure. I
Okay.
hope everybody else did as well. So thanks,
Yeah,
Dr.
and if-
Katie.
You're welcome. And if you have any more questions, feel free to email me. I'd be happy to help.
Sounds good. We'll make sure your contact info is in that follow-up email as well. So thank you. Thanks, everyone.
Thank you. Mhm.